Hi, I'm Dr. Melissa Joblin, one of the veterinarians here at the New England Aquarium. Today I'm going to be talking to you about our preventative healthcare program for marine mammals, focusing specifically on a dental procedure in one of our seals. This is Reggae, a 28-year-old male harbor seal. Just as you would take your dog or cat to the vet, he and all of the marine mammals who live here at the aquarium receive frequent, routine health examinations by staff veterinarians. This includes a thorough oral and dental exam. The trainers and vet team here work closely together to train the seals for husbandry behaviors, which allows them to voluntarily participate in their own health care. This helps to minimize stress and build trust between the animals, trainers, and vet team. One common husbandry behavior is routine teeth brushing. We use a special toothpaste that is formulated for dogs and a soft bristle toothbrush. Using a process called behavioral desensitization, Reggae has become accustomed to allowing his trainers to brush his teeth. As you can see here, he happily lets trainer Allison thoroughly brush all of his teeth. He also allows for a quick rinse with a mouthwash to help remove any extra bacteria. Similar to humans, dental health requires more attention as seals get older. We noticed Reggae had developed some built-up dental tartar, which required a visit off-site to a veterinary dentist. Prior to his dental procedure, Reggae had a complete physical examination, including an echocardiogram or an ultrasound of his heart, as well as blood work to ensure that he is healthy for anesthesia. Here you see another important husbandry behavior at work. AHD biologist Carrie is working with trainer Kim to train Reggae for voluntary blood collection. Just as you or I would have your blood taken at your doctor, Reggae will sit comfortably to allow us to take a sample of his blood from a specific site in his hind flipper called the plantar plexus. After a clean bill of health, Reggae was brought to see a board-certified veterinary dentist, Dr. Bonnie Shope, at her office. Here you can see the dental hospital and all of the equipment needed for Reggae's procedure. After being anesthetized, Reggae received dental x-rays and a CT scan of his head to see if there were any diseased teeth or other abnormalities of his jaw, skull, or mouth, which could cause any issues in the future. These diagnostics help Dr. Shope to plan the procedure and determine if any teeth need to be fixed or removed. Due to evidence of a cavity and some periodontal disease, or inflammation of the tissue surrounding the teeth, Reggae required extraction, which means removal of a few of his lower incisors. Following the procedure planning, Dr. Shope begins working on Reggae's teeth. While he is anesthetized, the aquarium veterinarians monitor him very closely to make sure that he is stable and not feeling any discomfort. We use several different types of monitoring equipment to track his heart rate, breathing rate, temperature, blood pressure, and other vital parameters throughout the entire procedure. We also placed a catheter into a vein in his back so we can give him fluids and any medications that might be needed during the procedure. Oral health is a very important factor in any animal's quality of life, and dental disease can affect overall health. The removal of unhealthy teeth is important to help prevent other disease or discomfort in the future. After his extractions, his teeth are thoroughly cleaned with a dental scaler to remove any residual plaque or tartar. Reggae did great throughout the entire procedure, and Dr. Shope is very pleased with how his teeth look. As Reggae is recovering from anesthesia, he received some extra fluids underneath his skin to help keep him hydrated, along with some pain medications to help keep him comfortable. His trainer Kim greets him as he wakes up from anesthesia. This helps him to feel comfortable, safe, and calm during his full recovery period. After he is fully awake, Reggae hops back into the transport carrier and prepares for a short drive back home to the aquarium. After return to the aquarium and following a good night's rest, Reggae is brought back to his exhibit. As you can see, he's very heavy, and it really takes a group effort to transport him around the aquarium. It even takes more effort to lift him up to get him back into his exhibit. After he checks out his surroundings and is greeted by his other friends, Reggae realizes he is home. Following some coaxing from his trainer Allison, and after testing out the water, he jumps back in. Since his procedure, Reggae has been feeling great and doing very well. Because of the dedication and hard work of the trainers and animal health department staff, Reggae continues to happily have his teeth brushed every day to ensure they remain nice and clean, just like you and I do. Thank you so much for listening, and we hope you enjoyed learning about a small part of the awesome preventative healthcare program here at the New England Aquarium.